I am Dr. Rahul Bhargava, Director of Hematology and Bone Marrow Transplant at FMRI Gurgaon, India.
Okay, my first question is, what role do stem cells play in cancer treatment?
Okay, so we need to understand there are two kinds of things which are happening: stem cell therapy versus stem cell transplant. Stem cell therapy has got no role at this present moment in treatment of blood cancers. But yes, stem cell transplant do play a great role in treatment and curing the blood cancers like acute myeloid leukemia, acute lymphoblastic leukemia, CML, CLL, multiple myeloma, and lymphoma. Because we know these diseases do originate from stem cells, and we need to replace the stem cells by an allogenic transplant so that these people can get cured. And over past many years, allogenic transplant has strayed into newer directions in terms of sibling transplants, match unrelated donor transplants, and half-match transplants. So in my view, bone marrow transplants is the one treatment which can cure majority of leukemias.
Okay, what role does bone marrow transplantation offer for cancer treatment?
So as we have just learned now that bone marrow transplant has the key role because it's a stem cell disease. In acute myeloid leukemia, 60 to 70% people can be cured with bone marrow transplant. Aplastic anemia, the only cure of 80% reaching is by bone marrow transplant. Multiple myeloma, it leads to progression-free survival close to 5 years, and so on and so forth. So in a nutshell, bone marrow transplant could be autologous or allogenic. In allogenic, it could be sibling transplant, match unrelated donor transplant, or a half-match transplant.
Okay. Is the concept of storing stem cells a good idea for new parents?
A very interesting question. So as long as these stem cells are going to be utilized for a public cord blanking, they are useful. It looks too much of a scientific knowledge or a science fiction at this present moment of time that if you store the stem cells for your own kid and your kid develops a heart problem or a knee problem, you put the stem cell and it will grow into heart and knee. That's still not proven. So these stem cells, umbilical cord as we call them, they are good for a public storage because that could also be a source for stem cells for curing other people and not your own kid.
Okay. Why did you choose to specialize in hematology?
It's quite a vibrant branch. As we know, the major technological breakthroughs which are taking place is in hematology right now. Right from immunotherapy to CAR T cells, they're all is happening in the field of hematology. In 1897, we first time recognized there were T cells, and if you can activate T cells, it can kill your tumor cells. It took us 100 plus years to make that into a therapy. And that's what excites us, that this is the frontier where we can save people by sheer understanding of how the body's mechanism functions or gets altered to cause cancer.
Okay. And lastly, what are the common cancers which come under the purview of a hematologist?
So as a hemon guy, we tend to see more lymphomas, myelomas, leukemias, aplastic anemias, chronic myeloid leukemia, chronic lymphoblastic leukemias, multiple myeloma, amyloidosis, myelodysplastic syndromes, where each and everything has to do with blood, comes under the purview of a hemato-oncologist in this country.
Okay, thank you so much.
Thank you.